Hey everyone, and welcome to a new series that I'm taking the time to put together. This series with the prefix WTF is aimed at addressing a number of different health issues, topics, or conditions that come up in the news which a nurse or a general member of the public may want to be informed about. So, with the winter season coming up, I thought I'd start off with whooping cough, as this time last year we had a number of outbreaks, as you can see here in these clips. So, WTF is whooping cough. Whooping cough is caused by the highly contagious airborne bacteria Bordetella pertussis. Because of misidentification and/or lack of treatment, it's also known as the 100-day cough because it can last for so long if left without antibiotics. It's most well known for inspiratory whoop, a violent coughing or vomiting following an intense fit of coughing. So, if you contracted whooping cough, you're most likely either an adolescent or adult. Before the 1990s, when there was no vaccine for whooping cough, however, it was infants and young children who were most at risk for contracting it. But today, nonetheless, infants and children still hold the highest morbidity risk, even with the vaccine in the public. Unlike the common cold, which can take about 3 days, whooping cough can take up to 3 weeks to incubate, and up to 1/3 of exposed individuals will contract pertussis. Fortunately, you're not considered infectious during the incubation period. Only once you start coughing, once you start having symptoms, are you considered extremely infectious until you've completed either 5 days of appropriate antibiotics or until the 3rd week from the onset of symptoms has passed. The pathogenesis of this bacteria is pretty straightforward. The bacteria lives in the upper respiratory tract and the nasopharynx, where it exudes a variety of toxins that damage the epithelial cells. The cells being damaged are the ones that are in part responsible for protecting your lungs from having anything drip or fall into them. Since you no longer have adequately functioning cells, your body has its backup system take over to clear out anything that shouldn't be going into your lungs, and that backup system is coughing. With such dysfunction of your epithelial cells, however, this is why a paroxysmal, or otherwise known as sudden and violent, fit of coughing is the hallmark of whooping cough. Your body's responding to foreign material in your trachea and your lungs, and/or an irritation, and its reflex is to cough to clear it until it's gone. So what can you expect when assessing or being assessed for whooping cough? Well, number one, in terms of history, you may be asked if there are any family members who have been sick. If a patient is an infant, they might particularly ask if siblings have been sick, as siblings are the most well-known vector for transmitting this disease. Other questions would include when was their last vaccination, and this is particularly important because many people think that once they've had their vaccines, they're good for life. Unfortunately, this particular vaccine shows nearly no effectiveness after 12 years. So you need to get a booster, which is recommended every 10 years after your initial vaccination. This is known as the Tdap vaccine, or tetanus, diphtheria, acellular pertussis vaccine. To determine the severity of the condition, we can also ask how the coughing has been affecting the patient. For example, have they been unable to feed or eat? Have they ever gone blue in the face or temporarily stopped breathing? Have they had any seizures or signs of pneumonia, fever? If the answer is yes to any of the above questions, then the person in question needs to go to the emergency room as soon as possible, especially if they are an infant. In terms of physical assessment, a simple respiratory assessment is appropriate for whooping cough to determine how well the lungs are functioning and to gather overall data about the respiratory system. That being said, a sputum or nasopharyngeal culture may be the best means by which to assess for the presence of bacteria, along with a chest x-ray to identify any fluid that might be collecting in the lungs. In terms of treatment, rest, nutrition, hydration, antibiotic therapy is the gold standard. However, antibiotic treatment is only recommended when the duration of symptoms has been less than 2 weeks. If the duration of symptoms has been longer than 4 weeks, it's been found that antibiotic therapy does not affect the course of the symptoms, but can reduce the spread of infection in high-risk populations. So, and this is important, if symptoms have lasted longer than 4 weeks, antibiotic treatment is only recommended for certain at-risk populations, namely healthcare workers, pregnant women, and infants, and individuals working with infants. In terms of prevention, make sure that your vaccinations are up to date, practice good hygiene, and be mindful of others who have contracted whooping cough and encourage good coughing hygiene. So, to summarize, whooping cough is a bacterial infection that can last for months if not treated quickly. It's infectious for up to 3 to 4 weeks after the onset of symptoms and will infect 1/3 of exposed individuals. It mostly affects adults and adolescents, but it's most dangerous to infants. Getting a vaccination is one of the best ways to prevent the spread of whooping cough, but you need to get a booster every 10 years. If you have contracted whooping cough, the best course of treatment is rest, hydration, and nutrition, and antibiotics if you have had symptoms for less than 2 weeks, or if you are or work with high-risk populations. If you have any questions or comments, please leave them in the comment section below. Constructive feedback is always appreciated, and I hope you stay happy and healthy. Cheers.